This is Scott Becker with the Becker Business and the Becker Private Equity Podcast. Today's discussion is Medicare for all. And bear with me on this because we're not against or for Medicare for all. In fact, we're one of these people that believes everybody in our country should have coverage. We should have coverage for all. But I'll tell you what the problem with it is in a second. And I applaud the fact, although there were so many things wrong with the Affordable Care Act, that it did bring down the people in our country without coverage from 20% to 10%. This idea, and I think most Republicans, most Democrats, most Americans should want us to have coverage for all. This is a laudable objective. But here is the problem. If essentially we have coverage for all, but we don't fix the supply problem of specialists and enough doctors for all, then we've really not taken care of the problem. We've essentially done what we talk about. We've written a check for something that we can't afford to pay for. So coverage for all, terrific, a good idea. But coverage for all without the hard problem solving in DC of figuring out how we provide supply and actually take care of access for all is an illusory promise. This concept is talking about coverage for all, Medicare for all, without talking about the much harder problem of how do we actually provide supply for all and healthcare for all, which is the real issue. How do we provide healthcare for all, not Medicare for all? Medicare for all might be short form for healthcare for all, but they're very, very different things. I look at our country, right now we've got 27,000 to 28,000 oncologists, but 2 million new cancer diagnoses a year. Those are numbers that just don't add up. So you could talk all you want about Medicare for all, about coverage for all, but if you don't actually do the hard work of providing supply for all and fixing the number of specialists in our country and developing more subspecialists and specialists, then we've got something that's artificial. It's fake. It's like inflating the economy by doing more national debt. It's the same concept. This concept of Medicare for all without solving supply for all is illusory. It's a mess. It's a political platitude. It's useless. We need to figure out supply and taking care of all of our people, not just sort of political slogans and platitudes. In any event, thank you for listening to the Becker Business, the Becker Private Equity Podcast. I'm constantly reminded of what happens in foreign countries where they've got coverage for all. Every person I know that's in a foreign country where they have coverage for all is buying healthcare outside of the coverage for all at a private healthcare institution. Just heard another story today about somebody in Portugal who had an accident in Portugal and, of course, had to get coverage, not through the national health system, not that they weren't eligible for it, they could get it, but that it was no good and they had to get coverage through the private health system. Same thing recently, friends that had traveled to Italy, had a horrible illness. They ended up having to get their real health care through a private healthcare institution outside of the national system. So when everybody talks about these national systems, they talk about Medicare for all. God bless you. Love it all. But work on the supply problem. That's the real problem, not your fucking political platitudes. Thank you for listening to the Becker Business and the Becker Private Equity Podcast. We hope you love this. We apologize for swearing. We get so worked up when people do these fake things about coverage for all when they don't really solve the real problem of supply for all and taking care of healthcare for all, which is the real need, the real means, what we really need to do. Thank you for listening to the Becker Business and the Becker Private Equity Podcast. God bless you all. Thank you very much.